All right, Neil, welcome to the Franchisee Spotlight. I'm sitting here with Neil Patel, who currently some quick hitters on where he's been. He's just passed his first year in business, going into year two. He was actually a resale who bought a current location down in Sugarland. And since that moment, he's in the top five in year-to-date growth percentage, up for the Rookie of the Year. And last week's current billable hours is 393 billables a week. Pretty astonishing from one full year in the books, Neil. Welcome and thanks for taking the time.
Sure, appreciate it, Dustin.
All right, well, let's just jump in, and we always like to start with your story here. So, you officially took over a place home Sugarland last July. What made you say this is the next chapter for me?
I've had a lot of experience in healthcare. I've worked in hospitals, I've worked with insurance companies, I've worked with different parts of the healthcare system and the ecosystem. And, I wanted to get closer to the patient. I wanted to get closer to the client. And I wanted to make sure that I can contribute at the ground level. And so I was looking for business opportunities, ones that I can connect with individuals specifically on a more personal level. And step away from being behind the computer in a more of a corporate role. And I knew that this was the calling for me, given some of my prior family experience where we received caregiver assistance and had such a positive experience that I know this is what I wanted to pass on to others.
Awesome. Yeah, we always got to have that reason why. And you also, being in the healthcare, you said I think you were in there for about 15 years.
Yeah.
What was it about home care specifically that drew you? Is it the personal experience that you had with it, or is it something else?
It is, and part of a good chunk of those 15 years was me being responsible for developing and implementing programs to reduce readmissions for patients who were just discharged from the hospital. And the type of populations that I was accountable for was really the seniors, the vulnerable, and the elderly, and those on Medicaid as well. And how do we prevent them from continually visiting the hospital systems after they've been discharged? And so I would have to make sure that we have plans in place to reduce those 30-day readmissions. And I know that was a really tough task for the clinicians, not knowing what happens outside their four walls. And so my role is to make sure we're engaging a lot of those other providers that are touching the patients at their home. And through that experience, I realized that that's the most optimal way of taking care of a patient, is really making sure that they can recover in their home. The hospital is no place to recover. The hospital is a sick care business, and being at home is where you want to be healthy and recovering. And so I knew that was the right setting for folks to consider getting healthy and having the best quality of life. So that's what drew me in on the home care side.
Awesome. And I mean, you talk about readmissions. I think we were aligned there ever since you met. We've always been trying to figure out what our readmission percentage is, and we track it. We do change of conditions and the impacts that we have. And as an industry as a whole, the future seems to be bright because now we got Medicare starting to look. There's new programs coming out through Medicare and A and B that pay for patients in home. And we've just never had, when I first started a place at home 13 years ago, we didn't have anything that paid other than Medicaid waiver services and VA a little bit. And today's VA rates are more reasonable. They pay on time, and VA has really gotten access to care as well. So these third-party payers are starting to see the impacts that we have, and it's on us. As I always say, it's on us as providers to show that. So awesome.
That is true.
All right. Well, I want to go back to your story about your grandmother, guys, because it's an incredible story. And there's a lot of things that when you started this business, timing wise, just kind of aligned with your grandmother, I believe.
Right.
How has that experience shaped your approach to the way you care for people today? You want to give us a brief story about it, about your grandmother?
Yeah, I'll give you a quick story of this is really what drove me into considering this as being a potential business opportunity and just something that was a calling. My father was an only child to my grandmother, and my grandmother raised me and my sisters in our house. I grew up in a multi-generational household, just like many first generations. And my parents were afforded the luxury of having a built-in babysitter with my grandmother. But as we grew older, my grandmother's health started to deteriorate, and my father, being the only child, really took on the responsibility of caring for my grandmother. And he spent the better part of 2 decades being her caretaker. And In our culture, that was completely appropriate. That was the expectation. But me and my sisters began to realize that my father was burning out too much, and he wasn't able to enjoy his vacation, wasn't able to enjoy time with our mother. We finally found out about a caregiver service. We hired this caregiver through an agency, just like a place at home, Sugarland. And this caregiver really turned everything around in the home for the positive. I let my grandmother get better and more appropriate care. I let my father get freed up to enjoy time away from the house, and everyone was happy. But then suddenly my father passed away about 2 years after we started that service, and we were all realizing, the family was realizing, maybe we should have done something sooner. And ever since that experience happened in 2019 when my father passed away, I realized that if there was an opportunity for me to open my business, this could be it one day if I wanted to go that route, because I know how much impact it had to families, not just the clients. And so that was that experience of seeing how that caregiver came in and just really allowed my grandmother, my father to just have a normal mother-son relationship and return to that, as opposed to like him always being a caretaker and asking the same questions about her status every day. So that experience was great because it allowed me to understand that it just didn't help my grandmother, but this actually helped my father. It helped him enjoy having that respite and being able to step away.
Awesome. Great story. Inspiring as well, you know. And my grandmother's still alive today, and I'm just starting that journey at looking at care through Rick and Chris up in Omaha. So like literally right as we are talking, I'm looking at like aid and attendance and VA benefits. So it's a great service we offer, and you know, a lot of people don't know what it is, and it's on us again to spread the word about how we impact people's lives for sure. I'm gonna switch gears here and see what fuels Neil's fire here. Are you ready?
Yeah.
All right. You've seen the healthcare world from many angles. What inspires you most about being on the front lines of the care in your hometown?
I've seen Sugarland grow, and I've seen it become very diverse, and I've seen the population age, and I've seen the need for us to take care of our neighbors and to take care of each other. And it takes a village to raise a child, they say, but it also takes a village to take care of our elderly. And what inspires me is that we don't want to forget about our elderly. They are valued. They need our help. They are dependent on us in those last years of their life. And we want to make sure they have a quality of life that is fair and appropriate for them. And so what drives me and what inspires me is just being able to provide that to others. I want to make sure I'm given that type of comfort later in my life, obviously. And so I want to make sure that I'm doing my part early on and making sure that we allow people to have the best quality of life before, you know, their time comes.
Awesome. And I mean, obviously the business that you're in, you take care of seniors, but you got a family. You're balancing now business ownership after 1 year. You got 2 young daughters just starting school today. You're a major contributor to your community. What keeps you grounded and motivated through all that juggling?
Yeah, it is a new mindset you have to have when you step into business ownership from coming from, you know, a corporate type of role for many years. But it's taken the support of family. It's allowing my family, my 2 young daughters who are 5 and 7, to really understand what dad does for a living. It's hard to explain that when you're behind a computer dealing with large programs and large institutions, but for them to know that their dad has clients and patients and they know their names and they draw pictures for them, that's motivating because they understand that I'm taking care of others. But what keeps me motivated through it all is really just seeing the smiles on my clients' faces, but also the compassion that my caregivers have. When I see that my caregivers go above and beyond for my clients, I know I'm aligned with them. I know that I'm around others that are like-minded, that have a similar passion that I do. And that's what keeps me motivated, as well as my team.
Awesome. Now going on to your lovely daughters here, kindergarten and second grader. If they were asked, what does dad do for a living now, how would they answer?
So as a kindergarten and second grader, they would say that daddy has patients that he takes care of in their homes. And we don't call our clients patients necessarily, but sometimes that's what they understand because her grandmother was an RN, was a registered nurse. So
Sure.
they hear a lot of stories about her taking care of patients. But I think that's what they understand is that I'm there taking care of others who have difficulty taking care of themselves and who may not be similar to, unfortunately, their grandmothers who are mobile, who are independent, who haven't suffered any sort of medical events that left them limited in any way. But there are others out there that have trouble and that need help. And so they understand now when they see someone who's elderly, who's needing that extra assistance when they go out in community events, they now understand that how I help them. They've seen me work with some of the clients, and it always brings a smile to my clients' face when they see my daughters as well. It's one generation meeting the other generation, and it's always a good interaction too. So they understand that.
Absolutely. You know, the elderly, I mean, they love the kids. You go to places, you know, assisted livings and memory cares, the
Mhm.
ones that are like that are built right by the daycares. I don't know if you noticed that down in your area, but they started really focusing on trying to put them by daycares because
Okay.
kids bring joy to the seniors' lives. So it's a great thing for your daughters to go and do. I used to take mine up to do some volunteer work, like during COVID. I had them go to a local rehab and wave at people in the window.
Mhm.
It just brings a smile to their face. So I'm
Yeah, it
sure your
does.
daughters are going to be very proud of you and learn from the best. So let's talk about challenges accepted. We're going to shift here. Every new chapter comes with a learning curve. What's one thing that surprised you in the first weeks as an owner?
I think in the first few weeks as an owner, one of the biggest learning curves was really trying to, as I made visits to potential clients, when I was getting to know the family, every family has a different dynamic, and every patient or every client has a unique set of needs. Not every single client with dementia is going to be cookie cutter. Not every single client with stroke is going to be the same. And really trying to understand their conditions is critical. But I think one way I really that helped me get over the learning curve was also learning the personalities and the preferences of each of my clients and doing personality matching for my caregivers as well. When I understood some of that intrinsic motivation and that what brings happiness to the client outside of the personal care that we provide or the companion care that we provide, or the lifestyle services, it was really focused on how do we keep this person happy? How do we make sure we can have the right conversations to keep them mentally stimulated, to keep them engaged, and keep them having a smile on their face when we walk in. And I think one of my biggest learning curves was getting to that part of the conversation with the client. And I eventually learned that's where I need to start my conversations. I need to start with understanding the client and their personality and what motivates them before I talk about all of the other type of care that we can provide to them. That way I can make sure I can establish that bond. And that's a key goal of mine for my caregivers now is the first thing I want them to do is get to know the client, establish a bond, establish a rapport, and have that relationship with them, because that really helps with the client's recovery in the long term.
Awesome. No doubt. Now, again, going back to your experience, what have you brought from your experience into your franchise play into your operations playbook?
Yeah, there's a lot that I could bring in, and working in different programs where there's a lot of different provider types touching the patient. Still thinking about how we can do a light diet version of that with some of our clients, right? And but I think from what I brought to this situation is I know how to collaborate with the different provider types that do touch our patients, like the home health agencies, like who provide the physical therapy, the occupational therapy, the speech therapy, and provide that RN oversight. And an example is, can my caregivers learn some of the therapies that you're performing with the client when you're here 2 times a week, so that we can do it 5 days a week for our client. We can help them. Although we're not licensed therapists, we can learn and we can monitor in a safe way of how this patient can continue to do their exercise. I've also explained to my clients that my experience is that your first 30 days after a hospital discharge or post-surgical is going to determine your recovery plateau for the next year. And that first year will determine your recovery plateau for the rest of your life. So it all starts with those first 30 days. And making sure that they're motivated to do what it takes in the home, whether it's therapy, getting them to that independence with being able to shower themselves, because we're not intended to be a permanent solution for all of our clients. Some of our clients are on different journeys. Some of our clients are not only on a they just want to be comfortable and have a better quality of life, but some of them are trying to recover from a difficult procedure or surgery, and they can meet their plateau, and they can be independent. So some things that I brought is encouraging and motivating our clients, coaching my caregivers through how to have those conversations to ensure they're doing the right things in those first 30 days, and how to partner with the different types of providers that would be interacting with the client, and making sure we're monitoring changes in conditions as well. That's another aspect that I bring from from my hospital admin days is when we're in home, are we monitoring for their vitals? Are we monitoring for their outtake and their intake and other conditions? If we're noticing something, speak up. Let's tell the family. Let's also tell the home health agency. Let's tell the hospice agency if one that's involved. And just making sure we're adding value and we're being able to provide a proactive assistance, as opposed to, oh, we have an urgent situation on our hands, we have to call and get back into the hospital. So those are some of the aspects that I bring from my hospital admin days that I try to introduce to our caregivers.
Awesome. Yeah, I mean, healthcare is so reactive as opposed to proactive. Even again, going back to our payer sources, they pay for things reacting to what just happened, right? Client goes in the hospital, we'll pay for their hospital stay. We're going to pay for their rehab. We're going to pay for their home health. But they just put a little budget into preventative care. How much could they save on the back end if they just did that, So I think they're starting to see that again. And again, I'm very excited for the future with third-party payers in our industry. So, and with someone like you, definitely tracking that, I'm sure you're going to be a big part in your community down there in Texas for sure. When things get tough for you, what's your go-to strategy for pushing through it? Coffee, wine, crying?
Yeah, I've had a couple hands in my head moments. I'll say that, and but I think the biggest strategy for me is having a coach that I could speak with and get good advice from it. I've been fortunate to have a strong coach in Shane, and being able to him being available to me to talk through situations, because he's so experienced with many years of owning an agency, and also communicating expectations, right? And communicating what with the clients, of when we need to be honest and have a transparent conversation about what we're experiencing or what we're observing in their home, and also having those type of crucial conversations with their caregivers. Sometimes you just have to be transparent up front so that everyone can come together and gather around to make the best go forward solution. It can't always be on you. You got to rely on your team, whether that's your coach or your office staff, and you got to rely on your caregivers, and then you got to include the clients and their families in these type of decisions, because at the end of the day, they're the ones who will benefit from it the most. And when you bring those type of if that's the way you can bring about a better solution to get you through those hard days, sometimes that's what works best for me.
Awesome. And you're right in that year. We talked, I think a little over a month ago. You're in that year now where you're going to have to build your team to keep supporting to that new level. Because looking at your billable hours weekly right now, if you stay on that trajectory, I mean, you're on your way to the 1M club pretty quick in the next couple months. So, and you're going to need a team to establish that. So fingers crossed. How's that going? I didn't even get to talk to Shane yet about your team, but I know that's a focus. Have you brought on a team member yet?
So we're talking. I have the job descriptions. We want to make sure that I'm making the right long-term decision.
Sure.
And sometimes you don't want to overthink it at the same time. And I was given good advice from another franchise owner, Fatima Kavasi in Dublin, Ohio, from a place at home, Dublin. And she said, when you realize you need the help, it's too late. And so, and it's so true, because it can become overwhelming. And you're going to have to pause on certain things. But I'm having conversations with the right folks who are going to be part of the long-term plans going forward. We're looking to at least have some support here in the office.
Awesome. If there's anyone you want to talk to, it's Fatima, even Natalie too, and a good handful. But Fatima, waited too long.
Yeah.
It took her 3 to 4 months because I was coaching her. It took her about 3 to 4 months to recover. She had such a fast trajectory, one of the
Yeah.
fastest growers we've ever had. And it just went like this and then flatlined for about 3 months because she couldn't get the team. She was sucked out of marketing. And that's the number one thing that I always tell people is once you stop doing marketing and meeting your community and you're getting sucked into day-to-day fires and operations and calls and caregiver. I mean, right when I was talking to you at the very beginning, you said a caregiver's calling, right? And then you got to have that person to help troubleshoot that call so that you can continue building. So you're
Yeah.
right there, man. You'll find some good people for sure.
Yeah,
Um,
but a different perspective is, in your first year, you want to learn your business inside and
oh
out.
yeah.
You
Go
want to
for it.
experience every single issue and every single problem and every single conflict that could come up because you want to be in a position to be able to coach your team on how to handle it effectively. And you may have a very experienced team that you bring in, but they may not know how to handle it the way that your clients want it handled or your caregiver should have it handled. And so you got to build that up initially. And, being a new business owner, I'm not new to the space of home care, given my personal experience and some of my professional background. But at the end of the day, you're the face of your business, and you want to just make sure that my perspective is trying to understand as much as you can before you invite others into the situation.
100%. 100%. Take your licks. Take your
Yeah.
licks. I think I've shared with you, like when I first went in, me and Jared went and did marketing at a homeless shelter because we saw it was like a Medicaid facility, but it wasn't a Medicaid facility. So you made
Okay.
caregiver call outs, just dealing with that grind. If you know how to do it, your team will start to recognize how Neil Patel did it, and then they'll learn from you. So let's talk about team culture and community, actually, while we're on that note. You know Sugarland inside and out. How has that helped you shape the way you serve local families or approach even more so the local families with your service offerings?
Yeah, I mean, having been around Sugarland, I kind of know how each neighborhood is set up. I know where a lot of the assisted living facilities and independent living centers are. And some of them that I visited are the ones that I did a volunteer opportunity for when I was in high school, decades ago. So I also know that Sugarland is diversifying, like I mentioned earlier. Not only are there is there a population that's growing elderly, but there's a young population that's coming in, and that young population is having their parents and live in the home with them, and they're aging in home as well. And those individuals are looking for, how can I get more help in my home? I want to have a lifestyle where I can leave and I don't need to worry about my parents are being taken care of. I want a lifestyle where I can go on a vacation because these are young professionals. They have children, they have high pressure jobs. They want to be in a position to go relief and go on that vacation. And they would love for their parents to come with them, but they know it's just not possible. So this is now the new population that I'm seeing in Sugar Lane is having their parents move in with them, but making sure that they have someone who can watch their parents. And so that's what I'm observing, and I'm educating as much as I can and advocating for. We can be that respite solution for you. We can be those ones that you call in, that we can assist your parents. Make sure that through our app-based platform, you're seeing how we're taking care of your parents on a daily basis. And that way you feel comfortable that your loved ones are being taken care of, and not being vulnerable, left at home by themselves.
Awesome. Awesome. What's something unique about your team or the way you've built culture in your agency so far? I mean, you're in a culture build. I guess, how have you built the culture with your caregivers? Let's focus on how you built that.
Yeah, so from the time that I engage with them on the phone to have a conversation if they're interested in an opportunity with my agency, to the time they come in and I meet them in person, the way I build my culture is I meet with each caregiver applicant one-to-one. Some agency owners prefer to do group interviews because it's more efficient for them, but I like to hand select which ones I'm going to meet with after I have a conversation with them. And when I meet with them one-to-one, we have lunch together. We get to know each other. We share stories about their caregiving background, the good, the bad, the ugly. Then they understand that, and that I'm trying to get to know them. And I cater and tailor my approach to each one of my caregivers like that. But the way I build my culture is getting to know each one of my caregivers individually. Sure. And I walk them in the door on the first day for each new client. I create caregiver profiles so that my clients can see what their qualifications are, their past professions, but also a bit about their personality. Because in this type of work, you got to be able to do some personality matching between clients and caregivers. And caregivers notice that when you go above and beyond to advocate for them, to really sponsor them in that regard, and that you're walking them through the door, you've reviewed a very detailed care plan with them, then they feel like they're being backed up and they're being supported by the owner and by the office. And so that's how I build my culture, is a culture of, you're not ever by yourself on an island with a client, although you may feel like you are, because we do a lot of, in this home care space, it's a lot of one-to-one care. You don't have a lot of colleagues that you can just go chat with about, are you noticing this about the client? That's who I am. So I always tell them, don't let things build up on your chest. If you're confused about a situation, you're noticing a change in behavior, come talk to me, because I know the client, I know the family, and I know how to have the conversation. And even if you're noticing something that seems to be a little frustrating, if you're noticing difficult conflicts that are happening in the home between family members, come to me. Let me have that conversation and make sure that we're here to support what's happening in the home. We're here to support you, so you don't feel like you have to be in the middle of everything. So that's how we try to make sure that's what we try to do here at the place at Home Sugarland, is build a culture around getting to know each caregiver, making sure they feel supported from not only day one, but throughout the time that they're working one-to-one with the client.
Nice. So alleviate some stress some weight off their shoulder, making sure they have someone to talk to. I think that's really important to caregivers as well, to be able to have an outlet, right?
Right.
And that's when you work in a skilled nursing facility or a hospital, you have an outlet because there's peers there. And when you work in a one-on-one setting, that's probably the hardest thing, is to have an outlet.
Exactly.
So it's like you do your thing, and the only person you talk to is the machine when you clock out and check off what you did all day. So have there been any moments where you thought, yep, this is exactly where I'm meant to be?
I've had a few of those moments when I've had family members hug me. I've had clients say they want to contact that VA social worker to put a good referral in for me because they were so happy with how I helped them. Not only with getting not only with them being taken care of by a great caregiver, but also getting their VA benefits set up, which is what we do at a place at home, Sugarland. We assist our veterans with getting their benefits at no charge, because that's what they deserve to have, and they're not always aware. But those are the moments when you notice the family seeing that, and knowing that the owner's always involved throughout the process, or the office is always involved, not just with the caregiver. When they acknowledge that makes you feel like, okay, you're doing something right. And you don't seek that acknowledgement every day. That's something that you're just supposed to provide. But when you notice that your clients are making observations of that, it does mean quite a bit.
Awesome. Yeah, and then down there specifically is getting those testimonials to the VA case manager is only going to help you, right?
Yeah, that's true.
We won't go down that hole. Looking back and paying it forward, if someone asks you, should I open a place home franchise, what's the first thing you'd tell them?
The first thing I'd tell them is, do you have the compassion? Do you have the intrinsic interest in taking care of others and having that human touch? You got to have the motivation to get through those tough days with clients who are on the different journeys, whether they're on a hospice journey, they're on a post-surgical journey, or they just don't want to be in a quote unquote nursing home, and they just want someone in their home to just give them better quality of life. You got to make sure you can meet the client where they are. You got to make sure you can develop relationships with the family members. And you got to be able to ask yourself, am I a good listener, right? Am I able to understand each unique client? And when you can answer those questions as a solid yes, then that will get you through your toughest days. That will make sure you know that it's time to open a place at home franchise. You're going to have difficult days because this is a human-based business. We're service-based. It's all based on human interactions. And so you got to make sure that you have the right motivation to take care of other people and develop relationships and bonds yourself. And I think that's when you know that you'll be able to open a place at home franchise.
Awesome. No, great answer. I'm going to go off the cuff here. With the corporate team here, who would you say is the most valuable corporate member? I want to get a shout out to any of my team members over here. Who would be the MVP of a place at home headquarters? And it can be Shane, but you work a lot with Shane. So
I work a lot with Shane. Yeah. So if it wasn't Shane, who's been an incredible help, who's always been available by text, by GChat, by picking up the phone, and getting on a call while I'm on the road because I have 30 minutes between client meetings to talk through a situation. If it's not Shane, then I would say it's you, Dustin. I would say specifically you, even though you wear the hat of CEO, you wear a lot of hats, and you're involved on not only a mile wide, but you're involved a mile deep with each of the owners and understanding what they've been through because you've lived the experience and you continue to advocate for our services. You've been pretty tireless in doing your efforts and across the nation as well. You know what's happening in each market, what our conflicts or what our challenges are in each market, and where the opportunities are. And so I would say, Dustin, you're probably the most valuable member next to Shane. And I'm not saying that to kiss any, because I don't do that, but I've known Dustin because I took over the place at home, Sugarland. And I knew from that experience how Dustin was able to keep his word. That Dustin was a person who kept his promise of making sure things go smoothly for every new owner that comes into the franchise, and he listens. I know, Dustin, you're not able to get everything right. You're not able to make everyone happy, but I know you've listened to everyone who's explained their perspective, and you've always taken it into account.
Oh, I appreciate that. I wasn't expecting that, but I appreciate that. All right. What does success look like for you, Neil, beyond business numbers?
I think success for me is just knowing that clients are happy and they're saying great things about my caregivers, and hearing that my clients are getting better. And better means so many different things to clients in our space. It can mean they're just more comfortable when they're in the hospice care. It could mean their families are so satisfied knowing that this caregiver is there to take care of the loved one and they trust them. It could mean that the client is starting to become independent after their surgery, and is able to walk, is able to self-toilet, self-shower, and it's because we've been there along the journey. Just knowing those situations, and I'm hearing those stories, that's what success feels like to me. Success to me also feels like my caregivers are happy and they're satisfied with not only the work that they're performing, because it takes a special person to do this work day in and day out, but that they know that they feel appreciated by me and by the office, and they're willing to say that they appreciate that they say I appreciate you, Neil. That for me, being there for my team is just as important as being there for my clients. And in this business, you gotta be available for both, and that's what success feels like.
100%. 100%. Happy caregivers provide good care, which ultimately turn your business numbers into better. So we're going to wrap it up here because I know you're a busy guy. I got 5 quick hitters. You ready?
Yeah.
Coffee or chai to power through the day?
Coffee. That's more caffeine.
100%. Chai. Never even had chai. Doesn't it taste like pumpkin?
Well, it depends on what you put in it. You got different spices. Yeah.
I'll just stick with coffee. Favorite way to spend time with your daughters?
Watching a movie.
Nice.
Teaching them sports. I love playing sports. I love watching sports. And so baseball and basketball, explaining them all the different sports is one of my favorite ways of spending time with them.
The Houston Rockets are a young and up and coming team. Watch out.
There you go. We took them to a Rockets game not long ago, and they loved it. And now I got to make sure I get the same. I just shouldn't have bought close seats to that game because now there's no other way. I wish I could move them to the upper deck, but that's not going to be possible now.
No, right? I know you got to buy when they're really, really bad.
Yeah, well,
Uh,
now that we have Kevin Durant, it's
yeah,
even an upper bowl ticket's going to be the same cost as a lower bowl ticket. So we'll see.
we'll see. What's one thing your team would say about you behind your back in a good way? So again, going to the caregiver side.
Yeah, I would say they would say Neil listens. He's always willing to get on the phone and he's responsive.
Awesome. What's your hidden talent or weekend hobby?
My weekend hobby, I got more hobbies than talents.
Sure.
um, but my weekend hobby is baseball. I've been
Baseball.
playing baseball every Sunday evening for the last 22 years. I played baseball from high school going forward, and it's just my outlet. It's my way of releasing. I want my daughters to come sometimes so that they can watch their dad, and I hear them cheering me on, and I love it. But that's my weekend hobby is playing baseball.
Nice. What position?
Left field.
Left field. All right.
Yeah.
So you can track the ball. Perfect. One word that describes your vision for a place at home, Sugarland.
It's hard to put it in one word, but if I had to say one word, I would say um, I would say compassionate.
Passion. All right. I would put there as well. I was going to say explosive. I think that you're on the right track to being a top performer. I mean, I watch everybody's numbers. You're always in the conversation. So you're going to have some humbling moments this next year.
Yeah,
I'd be willing to bet. But thanks for joining, man. And you've been a great addition to our team. And I know you're turning into a leader of the team, and people look forward to hearing from you out there. So keep growing.
appreciate it. Appreciate all the support.
All right, man. Well, I'll talk to you later. All right. Bye.